Have you ever been in a situation when you're working with the patient, you explained everything to them using the correct medical terminology, words, lingo, and concepts? They nodded their head and they said yes, but then they left and they didn't follow through on the treatment plan. They misunderstood the instructions. They stopped with their medication. This is not an uncommon problem that healthcare professionals in general face. And this is something that even I experienced when I was working in healthcare, even though I am a native English speaker, and whilst I was not involved in the clinical role, when I was giving instructions to patients when they were booking radiology scans, there was a lot of confusion in the way that they perceived the information that I was giving them. So, but if your patient says yes, but doesn't understand the real meaning behind the words that you use, this has got nothing to do with whether or not you're fluent in the English language. This is a problem of miscommunication. And clear English is not going to fix that, or fluent English or native English-speaking English is not going to fix that. Remember, in many cultures, saying yes means I don't want to embarrass myself, I don't want to lose face, I don't want to disrespect you, I don't feel safe asking questions, and I don't want to look stupid. So as a result, patients comply silently, and confusion shows up later as non-adherence, complaints, or blame. And like I mentioned previously, this is not a language problem, but it is a power, awareness, and cultural difference problem. The reality is that real authority isn't being understood once and that's the end of the story. It's being understood consistently, especially after your consultation with your patient ends. And that's why my coaching doesn't just focus on improving your grammar and vocabulary. It focuses on the nuances on how to communicate with your patients in a clear, empathetic, and authoritative manner, inviting honesty, transparency, and authenticity whilst holding space for their emotions without using your authority, power, presence, or time. And this is what I'll be breaking down in my upcoming webinar in the end of the month, where we're going to look at this concept along with several others that focus on the bringing back of humanity in healthcare. To register your attendance and details, I'm going to leave the information for that in the comment section below, so make sure that you click on the link, and I hope to see you there.